keeps us going because it's so hard.
A local family who tragically lost their son is using their heartbreak to save the lives of thousands of people. It could happen to any of us. The man couldn't get a refill on his prescription.
And it ultimately cost him his life. 19 News investigator Shannon Hauser showing what you can do to make sure this doesn't happen to you or a family member.
That's Devin and Kevin.
He was a healthy, active 27-year-old.
But always maintained his cross-country upbringing, eat healthy, exercise, live right.
So a sudden diagnosis of diabetes understandably gave Kevin Howdyshell's family a shock.
He thinks that there was a virus that attacked his pancreas and shut it down.
For the next 10 years, Kevin learned to control the life-changing disease, taking insulin daily to help manage the symptoms. But during the New Year's holiday in 2013, Kevin's parents got an unexpected phone call.
And told us that Kevin died. And we went, no, can't be.
Kevin's body was found at his home. His co-workers checked on him after he didn't show up for a shift at work. His parents, Judy and Danny, traced his last days, piecing together what happened. And they found out his death could have easily been prevented.
He had stopped on his way to work to have his insulin refilled.
Kevin's life-saving medication was expired. The pharmacist wouldn't fill it. Kevin tried calling his doctor, but it was a holiday. There was no response.
He was on the phone, kept redialing, wasn't able to get through. The pharmacy just sends him away. Sorry, we can't help you.
Right.
As parents, how does
Appalled.
that make you?
Appalled. Yeah.
A lot of sleepless nights.
Nights wondering how this could happen and why. At the time, Kevin thought he just had the flu, but not taking his insulin for days caused his body to shut down.
How can your son or one of your children or anybody stand in front of a pharmacy and not be able to get your life-sustaining medication?
That pain, those questions. It's why the Howdyshells decided to take action.
There was no objection to it.
In March 2016, Kevin's law took effect in Ohio. It allows pharmacists to give patients a 30-day supply of a life-saving drug like insulin, even if the prescription is expired.
It's working. It's working. It's worked in so many places.
The law saved Shannon Bennett's daughter, Morgan.
I've used Kevin's Law more than once to get refills.
Morgan was diagnosed with asthma at a young age. She uses her inhaler multiple times each day and has even been hospitalized a handful of times.
If she laughs really hard, she'll get an asthma, her asthma will act up.
But even with Kevin's Law enacted, getting an expired prescription fulfilled isn't easy for some families.
Pharmacists don't know the law.
Bennett says oftentimes she has to physically show pharmacists the law just to get her daughter's expired prescription refilled.
It is frustrating because I shouldn't have to beg for a drug that's going to keep my daughter alive.
I called around to a handful of local pharmacies. Some knew about Kevin's Law, others clearly didn't.
If I have a family member who needs insulin but their prescription is expired, are they able to get it filled there?
They would need a new prescription.
You can't refill an expired insulin prescription?
No.
Pharmacists are required to keep this state rule book behind the counter at all times. It's more than 3 inches thick, filled with constantly changing rules and regulations. If your pharmacist doesn't know about Kevin's Law, you can point to this book. Still, the law isn't mandatory. A pharmacist can deny a refill.
It needs more attention. I mean, we need to get it out there.
And on top of that, some insurance companies won't pay for a refill if it's expired. For Kevin's family, they know there's still a long way to go when it comes to making prescriptions affordable and available.
And this is only going to get worse.
And hearing stories of the law saving lives like Morgan's are heartwarming.
And that's the only thing that keeps us going because it's so hard.
While those stories dull the pain, ultimately, there's no prescription to cure the loss of a child.
Everybody says we should be so proud. It's hard to do. It's just Kevin's so deep in your heart.
Shannon Hauser, 19 News.
Well, since Kevin's Law was enacted here in Ohio, at least a dozen other states have passed similar laws allowing pharmacists to refill expired life-saving medications. The Ohio Pharmacists Association says patients are their own healthcare advocates and encourage you to remind pharmacists about the law if they aren't aware of it. Another idea, set a reminder on your phone when your prescription is about to expire.